you got to put these gloves on before you put your fingers in that kit. If you put your fingers in that kit, it's over.
It's like a pancake.
It is over. And see, when you test it, just go ahead and pull this all the way out. I didn't do it because I'm using her kit. Okay? But you got to put these gloves on. What size gloves you wear?
6.
We'll get you a 6, okay? Because this is totally different from the kit that we showed you last week. That's what I get when I'm talking. But if you go to the hospital with me and I'm working with patients, I move so fast. In fact, when I do so slow, I mess it up because I'm so used to doing it quick and not talking and teaching. But oh, that's why I got you another pair of gloves. It might be too little. Okay.
Demolish
The
those.
other thing is, it's a product of time.
Mm-hmm. What they're telling us. Okay. Okay. You guys might want to do this. When I do this, I just open this up inside the kit. But you want to make sure, if it's easy for you, you open this and sit it down. But make sure your fingers don't touch anything. Okay? Now, you got 2 sterile hands to handle this catheter with. Okay, now which hand, you remember the hand that you're going to keep sterile, you want to go ahead and wrap this around it. Okay, and look what's up there, this. Some people in this morning, they forgot and they had it backwards. Why did we have this pointed up? What we getting ready to do with this?
Between 7 and 8.
We connecting this to this. And remember, this hand's contaminated, so that's okay. And I shouldn't have went up there, but I did go up there, so I did break that right there. Let me do that again. After I touch this, if I go back up there, that's a break. Okay. So now, we want to check and see if our suction working. We're going to stick this in the saline and put this. What it's going to do is pull the saline into the suction canister. Once we know that's working, we're going to wrap this up so we don't contaminate it and it's not flopping all around. So now we're ready to give up suction our patient. And so we're going to remove this oxygen source, and every time before you start and when you're in and in between suction passes, you hyperoxygenate the patient. Okay, now we're going to unwrap this. Unwrap that all the way. Make sure you have control over it. Whatever way it helps you, is make sure you're going straight into that tray. I'm not touching the gown. I'm not touching the chest. My hands is on this tray, on this catheter. Okay? And we hit the carina. They start that coughing, which one of y'all can do if y'all want to. And we're going to pull back a 1/2 inch to an inch. And then we're going to start suctioning this patient by pumping our hands up and down and rolling this, pulling the catheter out. But look, as I'm pulling this out, I'm inching my fingers closer to the tip. The reason I'm doing that is, and I'm going to show you why, because if I just suction, see, this is going to flap out.
Oh, yeah.
See, and that's why when you have this in here, and you coming out, as you come out, you inch your fingers closer and closer to the bottom. So when you get to the bottom, you got the bottom of the catheter. And so it won't flop around and hit anything. You can get right here, clean that mucus out, and wrap it back up. And then you got to get them some more oxygen.
You, I think it says you can do 2 to 4 pumps, or do you need to do 4?
It's between 2 to 4 is fine with me. If you do 2, it's fine, as long as you're within that range that's on that sheet.
Okay.
Mm-hmm.
I don't know how I'll probably get 4, but in a skill I'm trying to get out of here, I'm like 2 pumps.
Yep. And it's going to be up to the instructor. They're going to tell you whether to do 1 pass, 2 passes, or 3. If you do a good job, I just tell you to do it twice. Or if you do a good job 1 time and your procedure is correct, I don't tell you to do it again. But if I tell you to do 3 passes, it's something. I'm trying to see what's going on. Okay? I could have cleaned this.
Yeah, do you clean it with saline before you oxygenate?
Well, I did clean it before, and this time the only reason I'm not going to clean it because that's my last pass, and I'm getting ready to take this off and put it in my glove.
Simple as that.
Oh, let me get her cap. And get her some more gloves. But your kid is a little bit different, and I wanted to show y'all that. And you'll see both these kits, the one we used last week and this one, in the hospital. And let's see, you said 6.5.